Okay, the next one is kind of following in the tails of that, and that's the belief that delayed cord clamping isn't normal or standard. It's like the exception to the rule to delay clamping the cord.
So let's talk about normal and natural, okay? So it's normal in the United States for women to have an epidural, but that doesn't mean it's natural. And
we're going to get a lot of people hating us for that. I agree with Heather, by the way. We can talk about that in another video.
Because it is an intervention. And
Yes.
so it may be normal to clamp the cord quickly, but that doesn't mean it's natural. That doesn't mean that's what should happen here. And we have to define these things. Like they took premature babies and they said, oh, we're going to have to lower their hematocrit because what we consider normal isn't normal for newborn babies. Well, it's not normal because they're doing early cord clamping. Or like twins. Let's talk about twins. Just because there's two babies doesn't mean for some crazy reason those babies are going to progress faster and their lungs are going to, like, there's still two babies. And so they say, oh, well, twins are term at 36 weeks, but a singleton is term at 40 weeks. They're only term at 36 weeks because you're not giving diet advice to these moms. And the body says, I cannot support two babies anymore. I'm evicting you. You've got to get out. And just because we've made it normal does not mean it's correct, that it's right, that it's natural.
Right.
And that's what we're looking at with cord clamping is the medical world has made early cord clamping normal and delayed cord clamping not the norm. But if you go into the midwifery world, delayed cord clamping is the norm and early cord clamping is you're crazy.
Right.
So, that's not the norm because we shouldn't be doing early cord clamping. And so I guess it's who you ask. Because for us, delayed cord clamping is normal.
Right. And yet here we are talking about how you need to do delayed cord clamping. It's the exception. It's, do something different than what your doctors do. Whereas the doctors, what they're doing is the exception from what they should be doing, at least according to history
Exactly.
and nature.
Exactly. And you have to look at interventions in it too, because there is the exception to every rule. Okay, we've talked about that. We'll continue to talk about the exception to every rule. And if you have a woman that you are giving high doses of Pitocin to get contractions going, and then you're keeping that Pitocin on a high drip right after baby's born, the uterus is going to contract more than it naturally would have, which is going to force blood faster. So you have to look at the different variables with this. You can't, there's not just because the baby was born vaginally doesn't mean there aren't a ton of other factors.
Right. But what we don't want to do is make the exception the norm.
Right.